So this is the volunteer orientation presentation for general non-provider volunteers. I always start off with the mission, vision, and values to remind myself why I do what I do and to let the volunteer know why they'll be doing what they'll be doing. So our mission is to change the lives of underserved Spartanburg County residents by providing quality and compassionate health care. Our vision is to be the model for the delivery of quality and compassionate health care for Spartanburg's underserved community. And our values are: we believe all individuals deserve access to quality medical care, regardless of ability to pay, and we're committed to providing compassionate care to individuals with unmet health care needs in an environment that maintains dignity of each patient. So what exactly do we provide? Our main focus is primary medical care. So the majority of our volunteer physicians that see patients in the clinic are primary care providers. And our one on-staff provider, our nurse practitioner, is a primary care nurse practitioner. We have an on-site pharmacy that's open 5 days a week, including some night clinic hours to allow patients to get their medications. Anything that we don't have in-house or that we don't keep a lot of in-house, we work with a program called Well Vista that will send those medications to our patients through the mail for free. Referrals for specialized care. So we work with about 100 partner physicians in Spartanburg County that are willing to see patients in their office for free for things leading all the way up to surgery. Comprehensive health education and preventative programs. We have volunteer health coaches that meet with our patients and dietitians that meet with our patients. We also provide them information and printed copies in the lobby, as well as in digital formats on our social media and our website. Mental health counseling, we currently have 3 mental health counselors, including one that does some psychiatry work with our patients and a telehealth provider so that our patients can get that mental health counseling that they need. We can also refer them to the mental health clinic in Spartanburg if it's a more serious issue that we feel is needs more attention than we can give. So our patients must live in Spartanburg County. They cannot have their own medical insurance and they cannot be eligible for Medicaid or Medicare. They must have a household income at or below 150% of the federal poverty guideline. And usually our patients are treated for some kind of chronic illness like diabetes, heart disease, and hypertension. Some demographics: about 53% of our patients are female, 47% male, 32% African American, 46% Caucasian, and 22% of another race or ethnicity. A snapshot of our needs. So we're targeting those patients who are falling through the cracks in our healthcare system, of the low-income populations. So those that do not qualify for Medicaid or Medicare for whatever reason, but can also not afford marketplace rates for insurance. In Spartanburg County, that's about 27,000 people, or 16% of the adult population that are uninsured. To put that number in a little bit of perspective, we have about 1,700 patients. So we're working as hard as we can, but we're really making just a dent in that number. So that many uninsured means that 15% of Spartanburg emergency room discharges are for non-emergency conditions. So patients that don't have anywhere else to go, they don't have insurance, they don't have a primary care provider. So when they have smaller ailments or they need more medication, they go to the ER, and that obviously costs more money, and that cost falls on someone. So we're trying to alleviate that burden off of the community as well. And 17% of Spartanburg County residents didn't see a doctor in the last 12 months due to cost. And that obviously is a problem because it's preventing people from getting those early signs and symptoms of illnesses caught and fixed before they become more serious and more expensive. Some fast facts. So we had $6.9 million of direct services provided in 2020 and over $19 million in indirect services. So direct services just means anything in our clinic. So appointments in our clinic, medications from our pharmacy, and then that indirect service is anything outside of the clinic. So referral appointments or medications through Well Vista, that kind of thing. We have 150 clinical and administrative volunteers, and that includes doctors and nurses. So we only have 1 on-staff nurse and 1 on-staff nurse practitioner, so 1 on-staff provider. Everyone else that sees patients is a volunteer. And they provided over 7,000 hours of service in 2020, even with us being closed to volunteers for a few months due to COVID. Our value of investment for every dollar that gets donated, it provides about $27 worth of services to our patients. So we really do know how to stretch a dollar, and that's due to being able to utilize these volunteer hours and these free appointments with our referral physicians. We work with a budget of just under $1 million. So you can see, obviously, we really do stretch every dollar that we get. So like I said, we have more than 150 volunteers, including doctors and nurses, and they provide over 600 hours of service each month. So they really are the backbone of our organization, and they are the reason that we can do what we do every day. So scheduling, volunteers will be scheduled for a specific service time, a certain day, a certain position, and a certain time they'll come. If they ever cannot come, they contact me or the Future Vista and let us know, just so that we can move people around and make sure that whatever position they were supposed to be at is covered. Arrival and sign in. So parking, we ask that everyone parks the back of the building, but walk around to the front to use the entrance. Unless for some reason they need to use the handicap entrance, then they can press the buzzer at the back door and be let in that way to use the elevator. And they can use either front or back exits when leaving. Always don't remind people to do not forget to log their hours. It really helps us out when we have a track record of those hours. Even if volunteers track those hours on their own, it helps us out to have those hours as well to be able to report them for grants and that kind of thing. The logbooks are an option. They're located in the chart room, at the back desk, and at the front desk, but I prefer if volunteers can use the text system where they will just text the word hours to 864-523-5983. They'll receive a link in response, and they'll click that link it'll open to a short form, fill that out, and that's how you log hours. It's just much faster that way and easier for me to track. Dress code, so we ask business casual or uniform. So scrubs are great. If a volunteer has scrubs, I always say that's the best thing to wear. If not, business casual. I always tell volunteers that it's probably best for them to not wear dresses, have their legs exposed, that kind of thing, just because I don't want to have to kind of manage what's appropriate and what's not as far as length goes. And also because it is an active clinic, and even if they're not working on the clinic floor, you never know when they may be pulled down there to help out or may have some reason to go down there. And we are an active clinic, and you never know what fluids you may come in contact with. Another reason, no open-toed shoes on the clinic floor. This is a legal thing. We cannot have open-toed shoes on an active clinic floor. No perfumes or colognes on the clinic floor. Some of our patients have some weird reactions to those, so we just ask people not to wear them. Emergency procedure: if there's a fire, get out of the building. We report to the First Baptist parking lot, which is located right behind our parking lot. If there's a threat, we have a silent alarm button at the front desk. It's under the desk, little red button. Or they can always contact 911, or our Executive Director, Patsy, has a protocol that she follows, and her extension is 26. If there's a tornado, we proceed to the basement or the stairwell, and obviously you stay away from glass and out of large areas. If the elevator stops working, first thing to do is stay calm. Call Patsy again at extension 26, or obviously you can call 911 to help you out there. COVID procedure: masks are still being asked to be worn at all times on the clinic floor. If volunteers are vaccinated and willing to share that information, they do not have to wear their masks on the basement or the second floor levels, but we're still asking everyone to wear their masks on the clinic floor, that first level when you walk in. Everyone needs to have their temperature checked at the front desk. Social distance when you can. Obviously, you can't take someone's blood pressure from 6 feet away, but we ask that everyone social distance when they can. We're still saying if a volunteer has symptoms, if they may have been exposed, or if they're waiting for the results of a test, to not come in, and just to let me know, and no one's going to be upset. We're going to be glad that they chose to be safe just in case. HIPAA, so the Office for Civil Rights enforces the HIPAA privacy rule that protects the privacy of individually identifiable health information. The HIPAA security rule sets national standards for the security of electronically protected health information. While we do use paper charts, we do have some information that is online, and we have to keep that protected through the security rule. And the HIPAA breach notification rule requires covered entities and business associates to provide notification if there is a breach of our information, and the confidentiality provisions of the patient safety rule protect identifiable information being used to analyze patient safety events. If a volunteer is willing to work night clinic, we have night clinic every Tuesday and usually every other Thursday from 5 to 8, Tuesday being our general night clinic appointments, sick visits, primary care checkups, those types of things. And then Thursday being our specialty visits with our orthopedics, our dermatologist, gynecology, rheumatology, all that fun stuff on every other Thursday night. If they're willing to work those, we usually have food. It's usually donated from a church, a restaurant, or an individual. If we don't have anyone that can donate that night, we usually purchase it from the clinic for those volunteers since they're willing to work through dinner time for us. And it's available to all volunteers that are working the night clinic. The next few slides are some of our more common positions for volunteers to work. It's definitely not an exhaustive list, but some of the more popular ones. So front desk assistant, we do have a staff member at the front desk at all times, but it does help them out, especially on the busier days, which will be Tuesday and Thursday, and also the evening clinic being the most busiest times that we have. It helps them out to have an assistant with them that can help them out a little bit. So checking patients in for visits right now, that includes a COVID questionnaire and getting temperature reads, answering any questions a patient may have, how to make appointments or anything else. Need to be comfortable with patient interaction. If a volunteer is not comfortable with patient interaction at this time for whatever reason, this is definitely not something that they should do, and that's completely fine. But they are speaking to every single person that walks in that door. Also, multitasking skills are a plus because it can get kind of hectic up there. Vitals rooms are taking vital signs of patients, recording chief complaints. They also go through their medications list with them and note what the patient is taking, not taking, if they're taking a medication different from how the prescription was written, all of that, just to make the appointments go a little bit faster. Previous experience with equipment is preferred, but definitely not necessary. Nothing is too high tech in there. We use the blood pressure cuffs that you just put the cuff on, press a button, and it does it. The only thing that's a little bit more difficult is reading blood sugars, and they do have to do a finger prick for that. So if a volunteer is not comfortable with blood, they really should not be doing the vitals room. Chart room, we do use paper charts, and paper charts are a ton of work. So filing charts, getting them pulled and getting the paperwork in there and organized for appointments, making new charts. We go through about 16 to 20 new charts a week, meaning new patients a week. So we can definitely use as many new charts as we can get. This is one that I like to suggest to volunteers that are maybe just wanting more volunteer hours and not so much patient experience, because they can go in there, put their headphones in, and just work for a few hours and help us out a lot, because there's a lot of work to be done in the chart room. Telephone operator, calling patients to remind them of upcoming appointments. So we try to do this because we have a lot of no-show appointments. We do have a system that automatically texts patients to remind them of appointments, but not all of our patients' phones are cell phones, and not all of our patients that happen to have cell phones have texting on those phones. So it helps out a lot if a volunteer can just come in, call patients for the next week, and just remind them that they have an appointment, when that appointment is, who it's with, and also to remind them to bring medications, because we ask that patients bring their medications to every single appointment just so that we can double, triple check that they are taking what they're supposed to be taking in the right dosages. So super important to have someone do this. Interpreting, so this is a picture of Hector. He's kind of our star example of a volunteer interpreter right now. He does interpreting and translating for our Spanish-speaking patients, but we have a lot of patients that speak Spanish, have a lot of patients that speak Russian, and also some Chinese Mandarin in there as well. So anyone that speaks a different language, we can definitely utilize them for either going in with the patient to interpret for the provider, or to do some written translating of material and educational things for the patients to have. Data collection and putting data that we take on patient demographics. We do some surveys occasionally, anything like that, and it just helps to have someone, again, that just wants some hours to put their headphones in, kind of zone out, and just put that information in a database or an Excel document that we can analyze. Virtual positions, so brand ambassadors. This is another presentation that I will record on Zoom but basically just someone that may be interested more on a marketing side of things, or someone that's interested just in the clinic overall, but maybe doesn't have the time to come into the clinic, but still wants to be a volunteer and help out where they can. So this is another presentation about the details of it, but basically someone that's just willing to promote us virtually through social media, that kind of thing. Data collection, if there ever is data that doesn't have patient names on it, I can send it out to my virtual volunteers and have them input it for me, but it is very rare that we have data that doesn't have patient name on it. Stewardship, this is thanking donors for their donations through our Network for Good software, and that will be also another discussion about exactly what that looks like. A lot of our brand ambassadors also are willing to help out with stewardship, so those two kind of go together. And obviously there's clinical volunteers, doctors, nurses, nurse practitioners, physician assistants, pastors, mental health counseling, pharmacy assistant, all are needed and appreciated. And I always remind here our volunteers to help us spread the word by liking us on Facebook, following us on Instagram, and checking out our website, because that is free marketing to volunteers, donors, and patients. So we want to really promote that. And then that's the end of it. This is a picture of Japonica. I like to show her off at the end here because she's awesome and she's a big reason why we're able to do what we do. But that's it. That's the volunteer orientation presentation.